Richard, I'd just like to be sure my speech is going to go a little longer than 3 minutes. Can I? Thank you for the honor of electing me to lead Washington medicine in the coming year. I'm looking forward to the challenge, and I feel up to the task. Let me tell you why. I don't have to tell you that we are in the midst of the biggest transformational change in American medicine in the last 50 years. And I'm a guy whose middle name could have been Change, a guy who grew up in an environment of change. My father served more than 40 years as a Presbyterian minister, and my mother spent those same 40 years mastering the art of packing and unpacking, of making a new house feel like a home. The life of a preacher's kid sometimes had its downside. When asked where are you from, the answer was never a simple city and state reply. It was a list of towns and schools. Leaving old friends and familiar surroundings was always difficult, but there was also an upside. Early on, I learned that change is a fact of life. And when you face it squarely and honestly, you soon understand it is an essential quality of growth and improvement. Change can not only be good, it has the potential to make things better. And we surely do need to make things better in healthcare, to try to bring order to this current state of chaos. No one knows how the Healthcare Reform Act is going to play out. Insurance reform, including exchanges, expanded coverage, more people covered by Medicaid, the requirement to purchase insurance for those not covered by Medicaid, and last, no clear source of funding for the long term in this deficit-driven economy. All this will need to be reconciled, and the sooner the better, given the budget crisis at both the state and federal levels. We are facing unfunded mandates in many instances. At the same time, some companies are threatening to leave the commercial insurance market. Congress made it clear last month when they authorized the Medicaid funding extension that that would be the last time. There would be no more money. And here in our own state, as we all know, Governor Gregoire has asked for all state agencies to cut their budgets by another 5% just to get us through this biennium. And here's the kicker. While all states are scrambling to implement the new Healthcare Reform Act, as many as 20 of them are also vigorously fighting to repeal it. It is a crazy time in healthcare, and it's a time that calls for courageous leadership. Physician leadership to guide us safely and wisely through this turbulence. I know the WSMA and Washington physicians are up to the task. We are well positioned to lead, and we've already put major pieces in place to make this happen. A year ago, this House foresaw the upheaval coming and passed a resolution directing us to create a plan to get ahead of these changes. This spring, many of you participated in a survey to determine what you want from your association, what you felt our priorities must be. You said, remain vigilant to fighting against the eroding economics of practicing medicine, but at the same time strive for a more outwardly focused organization, one devoting more energies and resources to the health of the public and less to government and insurance interests. You said you want your professional association to be engaged, to shape what we can, and to accept what we cannot. Throughout this past summer, your leadership has worked to develop this plan. The product of that effort is in your delegate handbook, in the informational section. I encourage you to support it, to read it, and to share your leadership's belief that this is a strategic plan that will serve us well. Your board has already taken the first steps to position WSMA as a steadfast leader and a major contributor in managing the change coming to our healthcare system. Let me give you two examples. First, accountable care organizations, ACOs. We all know there will be change in the delivery system. ACOs are the model du jour. We also know that these changes will be embraced by hospitals and other large organizations as their vehicle to attempt to shape and control the system. Those groups must be guided by physicians. We must have input into shaping how this new delivery system will work. Second, physician shortages. Between the call for establishing medical homes and a healthcare reform act that mandates insurance coverage for all, the demand for primary caregivers, general surgeons, and other specialists will far outstrip our profession's ability to meet the need. An easy answer for government and insurance is to substitute non-physician caregivers. You and I know the key to quality is that healthcare teams must be physician-led, and patients must be assured that their medical needs are being understood and addressed by all members of the team. We must insist that the standards of quality are consistent regardless of the type of license. We recognize these issues and have taken these additional steps to address them. First, this spring the board approved creation of our new Foundation for Healthcare Improvement. This isn't just a name change from the old ERF, it's a 180-degree pivot. The old foundation was dedicated to education and research. The new foundation's purpose is to help physicians cope with changes in the delivery system, to support information-based care, best practices, and patient safety, and to promote reductions in unsupportable variations in care. Second, this summer we added staff, a director of performance improvement to work closely with our members in managing these changes. And third, on Friday we offered the first in a series of programs that will be rolled out regionally. What I like about this program is it is for you and your practice team. If you miss this one, you'll want to sign up for the next one. We have a big year ahead. Some say a pivotal year. Many changes will occur, but I feel assured of one constant, one calm force amidst the tumult. Our association will stand, as it has stood for 126 years, as the promoter and emblem of quality medicine, the engine for achieving quality health care for all Washingtonians. There's some new ideas here, but we must never be afraid to try something new. As the graduation speaker said at Texas Christian University last June, remember, Noah had never built an ark before, but it was a large group of experts that built the Titanic. The difference between Noah and those shipbuilders was the shipbuilders saw it as a job, just a paycheck. For Noah, it was a calling, just as for us, medicine is a calling. Like Noah, some of the things we will be doing we have not done before, but I have faith that working together we can accomplish our goals, and I look forward to working with you this year to make that happen. Thanks.